objectives of today's lecture, we're going to talk about how alcohol damages a fetus, a developing fetus. We're going to talk generally about how alcohol can harm a mother and then also any of us by drinking too much. We'll go over a developmental overview, which is a little bit of embryology. And then we'll talk about other drugs, cocaine, heroin, marijuana, and how alcohol is different and what the data really says about those things. And then we'll end by talking about some clinical interventions, what we do when we're worried about someone. So I'll start with a case. This is something that I'm more used to seeing and that you might see in OB/GYN rotations. An 18-year-old female who comes to the emergency room, this is like a daily thing for me, complains of nonspecific abdominal pain, so it feels a little cramping, a little bit uncomfortable. They say that they feel bloated. They're having some pain, but it doesn't really go anywhere, and they feel a little bit constipated. We usually ask about GYN symptoms, any vaginal bleeding, any vaginal discharge, to kind of make us think, is there a possibility this patient could be pregnant? And they say none of that. They're otherwise a healthy person because they're only 18 years old. They don't have any surgical history, and they report that their last menstrual period was a few weeks ago. Vital signs. Do you guys know vital signs? Have you gone over that yet? So afebrile 98.8, heart rate 66, so that's normal, 60 to 100. Respiratory rate of 14, normals between 12 and 20. Blood pressure 114/70, that's good, that's a very normal blood pressure. And then room air sat of 100%. Physical exam, nothing. So you listen to their heart, listen to their lungs, press on their abdomen. There's nothing kind of focal on their exam. So what do you want to know? For me, I want to know, is this person pregnant or not? An 18-year-old female complaining of abdominal pain, the first thing to know is if they're pregnant. You diagnose that with a urine pregnancy test. And then for me, I usually roll the little ultrasound in and take a look and see if I can see anything. And so this is an intrauterine pregnancy. So you can see here, this is the uterus. It's the yolk sac. This is called the double decidual sign. You see kind of two rings. It looks like a balloon on a string. And so that's a very early intrauterine pregnancy. So this young girl is pregnant. And so what sorts of things should we tell her? Well, whenever anybody comes in with pain and they're pregnant, we usually tell them there's a chance that they can miscarriage. You never really know. If somebody's cramping, it could be an early miscarriage, or it could just be totally normal. So we usually counsel them that there's a possibility of miscarriage. We often provide them prescriptions for prenatal vitamins because most 18-year-olds that don't know they're pregnant are not taking prenatal vitamins. Does anybody know why we give prenatal vitamins? You know what's in them?
Folic acid.
Yeah, folic acid. So what does that do? Perfect. Yeah, so it's a very preventable way, or it's neural tube defects are very preventable. If you take a prenatal vitamin, your chance of having neural tube defects just plummets. So in the same respect, we also provide brief prenatal counseling. And what sorts of things should we tell them? Yeah. So stop smoking, right? Stop drinking, exercise, eat 5 small meals a day, and you need to see a gynecologist because you need monthly physical exams. You need to have monthly OB exams. So why is this important? Well, the class is obviously about fetal alcohol syndrome. We're not going to talk about smoking as much, but alcohol is a teratogen. So teratogen is a poison to developing cells, to a developing fetus. Alcohol is particularly potent as a teratogen because it actually can diffuse across the placenta. It can enter the fetal circulation via the mother and then via direct diffusion, and then it damages all sorts of cells. It's cellular toxic. I mean, when you clean a table, you use either bleach or alcohol, right? Because alcohol kills things. Majority of pregnancies in the United States are unplanned, and alcohol is a very common drug. It's a legal drug. A lot of people use it. So physicians have a really important job. We have to counsel patients. We have to counsel patients before they're going to get pregnant, if they know that they're pregnant and they weren't planning on it, and right after pregnancy. So they need to know that alcohol is very dangerous, just like they need to know smoking is very dangerous. If you don't counsel, then the things that you're at risk for are fetal alcohol syndrome, fetal alcohol spectrum disorder. Fetal alcohol syndrome, as it sounds, is a syndrome. It's definable. It has facial characteristics. It has physical exam findings. And this is the face of a child that has fetal alcohol syndrome. They have short palpebral fissures. They have a flattened midface. They have a short and flat nose. They have an indistinct philtrum. You know what a philtrum is? Everybody's going to be checking out everybody's philtrums now. This is what happens in the class. The philtrum are the 2 lines that lead from your nose to your upper lip. Kids with fetal alcohol syndrome have a very flat philtrum. You cannot distinguish the philtrum. They also have a thin upper lip micrognathia, so they have a kind of flattened face, a flattened chin. And then it's also, there tends to be associated features. They're epicanthal folds, they have a low nasal bridge, and they have some ear anomalies as well. So this is a face of a child that has fetal alcohol syndrome. And pediatricians are trained to look for this face and to diagnose fetal alcohol syndrome based on these findings. Fetal alcohol spectrum disorder is kind of what it sounds like. It's not a syndrome, it's a spectrum of findings. It's an umbrella term. It describes a whole range of effects that can occur when an individual's mother drinks alcohol during pregnancy. It can be minor things, it can be really serious things, it can be full-blown fetal alcohol syndrome. They can be physical anomalies, it can be physical deformities, they can be subtle mental issues, they can manifest themselves in elementary school and middle school down the road when you're an adult and looking for a job. They can be behavioral, and they can be learning disabilities, and oftentimes, even if they're subtle, they can have lifelong implications for the people that live with them. FASD, Fetal Alcohol Spectrum Disorder, is not a clinical diagnosis. So when I showed you the picture of the child that had the face of fetal alcohol syndrome, when you come to the office, I could write on the chart fetal alcohol syndrome, and that's a diagnosis code. Fetal alcohol spectrum disorder is not a diagnosis code. Do you guys know a little bit about billing? Have you gone through that at all? So when you go to the doctor's office, I say, I spent 30 minutes with this patient. It was a complicated history. The reason why is because they have congestive heart failure, and that's the diagnosis. If a child that has kind of subtle cognitive effects comes to the pediatrician's office, you're not sure what it is, but you know that the mom drank during pregnancy, you can't write on the chart, this was a complicated visit, I spent 30 minutes with them because they have a spectrum, they have a fetal alcohol spectrum disorder. That's not a diagnosis code, you can't bill. And that seems kind of silly, but medicine is a lot about business, as much about business as it is about science in some respects. So if you're gonna spend 30 minutes with a family talking to them about these effects, you can't really bill for it because there's nothing to write. The insurance companies aren't going to reimburse you. Does that make sense? It's a little bit of a funky sticking point, but it's really important to know. If they have fetal alcohol syndrome, then you can write that if they meet the diagnostic criteria for fetal alcohol syndrome. So how do we actually diagnose it? So the face is really important, but there are also a number of guidelines that can help you make the diagnosis, just like there are guidelines for pretty much everything in medicine. The Institute of Medicine published a guideline for fetal alcohol syndrome. The University of Washington has a big center where they did a lot of background studying. They studied a lot of kids. They came up with a 4-digit diagnostic code that aids pediatricians and physicians in diagnosing FAS. Similarly, the CDC came up with a guideline, Fetal Alcohol Syndrome Guidelines for Referral and Diagnosis. And then the Canadian kind of sister organization, brother organization, the corresponding organization in Canada came up with FASD diagnosis guidelines. ICD-9, that's the International Classification of Disease, the book that gives us all the codes that we write on charts when there's a diagnosis. They define it as a couple of things. There's a growth deficiency, meaning that the child has prenatal or postnatal height or weight at or below the 10th percentile, so a very small child. They have the facial features. They have 3 of the facial features present. They have evidence of central nervous system damage, meaning there's a clinically significant structural, neurologic, or functional impairment. And then you don't have to have prenatal alcohol exposure confirmed. It can be unknown. So a number of children that are adopted from other countries, so for example, Russia, there's a huge problem with alcoholism in Russia, and a lot of, as well as South Africa. I don't know if you've read, there was an interesting article in Time about the way that women in South Africa are paid to work on wineries. They get paid in wine. They don't get paid in dollars or in South African currency. They get paid in wine. So young women that are working, that are picking grapes, making South African wine, are getting paid in alcohol. And they obviously use it or they sell it. And so fetal alcohol syndrome is a big problem in South Africa. If you adopt a child from a foreign country, you may not know if that child had exposure to alcohol, but if they meet the other criteria, you can still diagnose them with FAS. So it's an important thing to know. Now, as with anything in medicine, there's a differential diagnosis. So whenever you see something, you need to consider other things. You don't want to jump to the gun. If somebody comes in with shortness of breath, you don't want to say it's congestive heart failure until you've ruled out pneumonia, until you've ruled out MI, until you've ruled out PE, aortic dissection. There's a lot of things you need to consider before you actually diagnose something. So there is a differential diagnosis for fetal alcohol syndrome. There's an overlap, and there are a lot of things that I don't even know how to pronounce anymore because they're so rare and I've never really seen them. But this is what the CDC wants you to think about. These are kind of rare syndromes. Fetal hydantian syndrome, fetal valproate syndrome. So these are drugs that kids are exposed to that cause syndromes. But none of them have the characteristic facial features of fetal alcohol syndrome. They don't have the 3 facial features. So that's where FAS is different. And that's why if you have a kid that has the facial features, that really should lead you down the path of diagnosis. And this is a picture of a baby that was born after prenatal alcohol exposure and has the facial characteristics. They have the small eye openings, they have the smooth philtrum, they have the thin upper lip. So this is something I really want you to look at and try and remember. So let's talk about how alcohol actually does all these things. So this is a great picture because it shows you an age-adjusted brain. The one on the right is a brain that was exposed to alcohol in utero, and the one on the left is a normal brain. Now, obviously, something happened that we're seeing the brain on the left, but it's the baby died on the left not from fetal alcohol exposure; it was from something else. And you can compare the brain of the 2 individuals. So this brain is significantly smaller. So obviously, alcohol is doing something to the cells to prevent them from developing properly. The way it does that is a couple of things. Direct cell death, and it's the exact example I gave earlier. When we clean tables, we use bleach, we use alcohol because it causes cell death, it causes direct cell death. And alcohol does that to developing cells in utero as well. But there are also a lot more complicated things that go on that lead to fetal alcohol syndrome. One of them that we'll talk about is incorrect cell migration. So during embryologic development, the cells are not traveling to the right positions, the positions that they should be. And you guys just went through this with embryology. It's pretty complicated the way that cells multiply and divide and manage to go to the specific parts of their body and the miracle of life. I mean, the fact that a baby can do all this and start from a few cells is really impressive. And alcohol prevents the natural course of events through this aberrant cell migration. We'll talk about that a little more. And further, if the cells have survived the initial insult of the direct cell death, if they made it to the right place, well, even so, alcohol can have a negative effect. It can change the metabolic structure of developing and reproducing, replicating cells, leading to inappropriate growth. So if you get to the right place and they're still alive, then they may grow inappropriately. Does that make sense? Just trying to break it down, make it really simple. So what is a drink? This is good to know. This is good review from college, and I want to take this to the Georgetown undergrads because they show up every Friday and Saturday night just wasted in the emergency department. It's really crazy. I mean, it's pretty amazing. And unfortunately, if you're under the age of 18, we have to call the parents, and that's really challenging. They don't like that very much. But one standard drink is much less than the bars on M Street would have you think. It's a 10 to 12 ounce beer. So if you're drinking out of a bottle, then that's one standard drink. It's not this size drink. It's a 5 ounce glass of wine or a wine cooler, or it's 1 shot or mixed drink, which is about 1 ounce of like 40 proof alcohol. So it's like a shot, like a standard shot glass. And that's one standard drink. Now, of course, when people say they have one drink, that can mean different things to different people. And that's where counseling and screening is really challenging, because you try and figure out if somebody's an alcoholic and they're coming to your office and they say, well, I have 1 drink a night. If that drink is a triple shot whatever, then that's a problem. If it really is 1 glass of wine, then it may not be a problem. So that's really hard, and you have to kind of hammer that out, and you have to figure out with your patients. And so knowing what a standard drink is really key. So try and keep that in mind. Try and remember that. How does that transcend and translate into blood alcohol level? So the numbers we get are actually different from the ones the police report. The police usually report in percentage points. So the legal limit is 0.08. I believe that corresponds to a blood alcohol level of 80 when it's reported in the hospital. So if we get a level of 400, then that corresponds to 0.4. All right? And some people show up with blood alcohol levels of 0.4, which is crazy, and they're not breathing, they're really, really sick. So when you drink an alcoholic beverage, it goes into your stomach, it's absorbed into the bloodstream, usually in the stomach, and from there, where does it go?
Everywhere.
Yeah, totally. Yeah, so it goes everywhere. So it goes to your brain, right? And it diffuses across the blood-brain barrier. and it makes you feel drunk, it makes you feel high, or whatever it does. But who scavenges alcohol? Where is it metabolized?
Liver.
Yeah, perfect. So here's my happy liver. How much can the liver handle, do you think?
1 drop per hour.
Yeah, perfect. And so that roughly is about 1 ounce of like a pure alcohol, so like a shot, or 5 grams of alcohol roughly. So the liver can handle about 1 drink an hour. That's why they say, if you're driving, it's probably safe to drive if you've had 1 drink after a full hour has passed since you finished the drink. If that makes sense. Although you really shouldn't drink and drive, but that's kind of the rule. Any more that you ingest is going to stay in the bloodstream. It's going to go to the brain, cause inebriation. It actually distributes in fat as well. So fat is kind of a storage device for alcohol. And then in pregnant women, it actually goes to the fetus. So it goes, diffuses across the placenta, it diffuses into the fluid that surrounds the baby, and then it can actually enter the fetus's bloodstream. So it diffuses in water, it diffuses in fat. This shows you kind of the percent of body water as you age. So the fetus is almost 100% body water because it's circulating in water. A baby is a lot body water, it's almost 80% body water. A normal adult is roughly 70%, and then you lose body water as you get older. And so that's just, you have the water, you have the non-water compartments of the body. Alcohol is water soluble, so it tends to move into the water compartment. So that's why the fetus is very affected by it, because you have to assume that every cell of the fetus is being affected by the alcohol, because it's 100% water.
I have a silly question.
Yeah.
If you're overweight, does it take you longer to clear
Mhm.
the alcohol since it's being stored?
Yeah, so it can be sequestered, definitely.